150, kahit yung creatinine, uric acid bumababa. Pero isa lang yung problema, yung LDL ay tumataas. And after that, you were advised to take statins and other medications kasi nga, sinasabi na nakakatakot yung pagtaas ng LDL kasi eto daw ay risk for a heart attack. Totoo ba ito? Let's see what the new evidence is actually saying. For the longest time, akala natin yung LDL ay cholesterol na masama. I myself before studying low carb in depth, kino-consider natin yung LDL as bad cholesterol. But sa totoo lang, LDL is actually not a bad cholesterol. LDL is like a neutral cholesterol. Depende kung ano yung kanyang kasama, it can be good or it can be bad. Kung yung LDL ay mataas, but kasabay nito ay mataas din na HbA1c, mataas na VLDL, mataas na triglycerides, merong signs of inflammation, merong matataas na ESR, CRP, sobrang taas ng WBC, sobrang taas ng hematocrit, sobrang taas ng platelet, mataas din yung uric acid, SGPT, SGOT, then it is a dangerous kind of LDL. LDL, when paired with inflammation, that is scary. But LDL, isolated increase in LDL, is actually not a risk for heart attack. If you don't believe me, let's check kung ano yung sinasabi ng journal na ito na kakapublish lang 2 days ago. It's dated February 11, 2022. So today is February 13, and this one was published just 2 days ago. So nakita nyo yan, that is February 11, 2022, and this journal in JAMA Network. So yung title niya, Association of Coronary Plaque with Low-Density Lipoprotein Cholesterol Levels and Rates of Cardiovascular Disease Among Symptomatic Adults. So, meron silang chinek, hindi lang basta yung LDL, but tiningnan din nila yung other signs like coronary artery calcium score. This is the CAC scoring, or also known as cardiac calcium scoring. So this is a known scoring na kung saan kung mataas yung amount of calcium in the blood vessels na nagpapalibot sa inyong puso, then that is the higher risk of heart attack. And in conclusion, nakita dito na the higher the LDL is not actually hindi siya directly associated with risk of heart attack. In fact, LDL spectrum, as long as merong absence of associated na CAC score, if your calcium score is low, then the risk for heart disease is actually not high. So if ever sasabihan kayo ng inyong doktor that you have high risk of heart attack, try to ask also, baka pwede kayong magkaroon ng CAC examination. Patingnan muna yung inyong coronary artery calcium score, because if it's just 0, then maybe you are not really high risk. If kayo ay nagsisimula pa lang sa low carb, and if you have the budget to check this specific laboratory, mas mabuti so that you'll have a baseline. Because there are also people na nagsisimula silang mag-low carb na meron na silang plaque to begin with. And it's also not a contraindication na kapag meron ka ng risk for heart attack is hindi ka na maglo-low carb. In fact, the build-up of those cholesterol plaques, of those calcium in your heart is not really directly related to the calcium per se or the cholesterol per se that you are eating, but it can be related to your high sugar consumption and also your high consumption of inflammatory oils. Yung mga inflammatory oils na yun na yung mga vegetable oil na usually it's very, very processed, factory made na nakaka-lead into build-up of these bad cholesterol in our vessels. So, if you want to know more about your LDL score, you have to understand na hindi ito standalone. It's better if you can check for your calcium scoring and also your risk for other diseases if you have higher levels of other blood value. So the next time na meron kayong nakita na pagtaas ng iyong LDL cholesterol, don't consider it as a standalone diagnosis na di porket mataas yung LDL mo ay magkakaroon ka na ng heart attack. The evidence is showing right now na it's not actually the LDL that will increase your heart attack, but it's really the CAC score because marami na naka-low carb, tumataas yung kanyang LDL, but it's not associated with other lab values na together with inflammation, and their CAC score is actually zero. And when your CAC score is low, then your risk for heart attack is also low. Meron ngang mga studies showing na LDL is not a determinant alone. There are people na mababa yung kanilang LDL, but still their risk for heart attack and the incidence of our heart attack is even higher because the better gauge for that, kung hindi man yung CAC score, kung hindi man yon kinukuha, then you can also check for your triglycerides to HDL ratio. Pwede rin i-check ninyo yung remnant cholesterol ratio, yung sobra sa VLDL na yun talaga yung totoong bad cholesterol. So this study was just published 2 days ago. So with all due respect to your doctors, if ever matatakot kayo, nasasabihan kayong nakakatakot yung mataas na LDL, just politely ask if nabasa na ba nila yung bagong journal na lumabas ng JAMA Network saying na this is actually not the case. Hindi actually siya ganon ka nakakatakot. Yung sa conclusion dito, the findings of this cohort study suggest that in symptomatic patients with severely elevated LDL-C, at least 190 milligrams, who are universally considered to be at high risk by guidelines, based on guidelines before, ay consider ng high risk, but with absence, kung walang calcified and non-calcified plaque on coronary CT angiography, was associated with low risk of cardiovascular events. These results further suggest that atherosclerosis burden, including CAC, can be used to individualize treatment intensity in patients with severely elevated LDL-C. Hindi lang basta-basta na kapag yung LDL mo ay mataas, ay considered ka ng high risk because it is not the best gauge of determination when it comes to cardiovascular risk. This is again published in JAMA Network in cardiology, in the field of cardiology, published just February 11, 2022. So always be respectful if ever you will try to ask for further evidence na kakailanganin niyo talaga ng treatment to lower down your LDL because there are also studies showing that lowering of LDL in all-cause mortality might not actually really help. Hindi siya nakakatulong to extend life. Hindi siya nakakatulong to prevent the risk of heart attack, especially if you are lowering just the LDL pero hindi mo ina-address yung root cause of heart diseases, which is the inflammation. And inflammation is usually fueled by too much insulin in the body, too much inflammatory response na when it comes to our food intake, usually associated with too much sugar, too much fructose, too much starch, and too much toxic oils na ginagamit natin sa ating pagluto, yung paggamit natin ng margarine, yung paggamit natin ng mga seed oils na hindi talaga nakakabuti sa ating katawan. So this is just going to be a quick live episode for LDL, especially yung mga takot na takot sa kanilang LDL. And if you wish to know more, we thoroughly discussed this in our masterclass for fatty liver, hypertriglyceridemia, hypercholesterolemia masterclass for you to fully understand kung bakit tayo nagkakaroon ng ganito and what we need to do if we want to normalize it the natural way using our low carb and fasting protocols for your guided educational course. So maraming salamat everyone. I wish you well. I hope you will have zero CAC score if ever ipapakuha nyo yon. And always remember to stay low carb so that we all stay safe. And if you wish to be a part of our masterclass, message lang po our admins at LCF Masterclass by yours truly. Have a good night and advance happy Valentine's to everyone. Maraming salamat po.